Hi, I'm Dr. Kong Wai Yu, consultant nephrologist working in Bukit Tinggi Medical Center, dealing with various kidney diseases, dialysis or kidney transplantation. Our kidney play very important roles in toxin excretion and also regulates our body water content. In addition to that, it also helps in regulating the blood pressure, electrolytes, maintaining the bone health, and also in the production of red blood cells. Because of all those functions, so it is very important to take care of our kidneys in order to avoid deterioration in kidney function and dialysis or kidney transplantation. Chronic kidney disease is a condition where there is slow deterioration in kidney function over a period of time. In terms of months to years, there are 5 stages of chronic kidney disease. Stage 5 chronic kidney disease is the most severe form, where the patient will need either dialysis or kidney transplantation. As I mentioned earlier, when the patient develops stage 5 chronic kidney disease, where the GFR is less than 15, or when they develop symptoms with accumulation of toxin in the body such as tiredness, unable to consume orally, vomiting, or when there is extra water accumulation in the body, especially in the lung, causing shortness of breath, that is the time that the patient will need dialysis or kidney transplantation. In terms of hemodialysis, the patient need to come to dialysis center 3 times every week at the minimum, and every session of hemodialysis will last about 4 hours. So what happened during hemodialysis? The nurse in charge will needle the fistula, and then the blood will go through the artificial kidney, where the artificial kidney will remove the toxin and extra water from your body, and this process will go on for 4 hours. If they miss dialysis for a few sessions, the toxin will accumulate and extra water will accumulate, causing discomfort such as vomiting and also difficulty to breathe. If nothing is done for the patient, the toxin will cause major organ damage and patient death. Prevention is better than cure, so we must prevent kidney disease to happen before it's too late. First of all, healthy lifestyle modification. We must modify our diet with regular exercise, control our weight, avoid obesity. Obesity is one of the major risk factors of chronic kidney disease in the world. Second, for those patients who have underlying diabetes or high blood pressure, they must really control their sugar and blood pressure adequately, and has been shown in the statistics that diabetes and hypertension are the 2 main causes of end-stage kidney disease needing dialysis in Malaysia. About 70 to 80% of the patients have these 2 conditions leading to chronic kidney disease. So in conjunction with World Kidney Day, I would like to ask everybody to take care of your kidneys and live a healthy lifestyle.
I wouldn't say that I have any advice to give, but more like sharing of my own technique of how I try to overcome the challenges. I have my own technique called 2A and 2E. So first A is acceptance. We have to accept that this is our life, and it is still not such a bad situation. I always compare against that. Although this is my life, it's not so bad because I could be suffering from cancer or some other disease that is even worse than this. So I look at life in this way, that we have to accept what the reality of the situation. And we know that this is medically, it is not an ideal situation, but life could be worse. So try to get some comfort in that. The second A is appreciation. First of all, we have to appreciate our family members, our caretaker who spend a lot of time for us. And to appreciate that, we have to be less of a burden to them as much as possible. That we have to appreciate that our situation is, although it's bad, it's not the worst. It's still better than a lot of other situations that can occur. Then the 2E, the first E is engagement. Engagement with life. Don't give up on life yet. There's still a lot of things you can do. I'm still working until today, and I feel that a person should try to work as much as possible so that he keep the mind active. If you don't have a work, it's also you have to engage in productivity so that you keep yourself interested in life and all these things. You also have to engage with your hobbies. That you have to get whatever activity that you like gardening lah, or reading and then watching movies. So that to make the life more pleasant, and also the engaging with learning new things even today. Keep your mind engaged. However, don't give up on life yet. You must engage with life. And last, equally important thing is exercise. To be less of a burden to others, do what we can to have a serve. We have to prolong our healthy life for as long as possible, so that it's more for our benefit rather than for other people as well. But also we have to think of helping the other caretaker, that they don't be so much of a burden to them. So that this is what I try to cope with the challenges that I'm facing.